Diagnostic arthroscopy of the Minipig knee for translational large animal research. We have no disclosures. For those that are accustomed to knee arthroscopy in humans, there are several considerations to take into account when performing knee arthroscopy in the Minipig. One, of course, is the smaller size of the Minipig knee, for which we use a 2.4 millimeter arthroscope. Another is the more proximal positioning of the patella in the Minipig, equivalent to patella alta, and therefore the portal should err on the side of being more distal to the distal pole of the patella. The Minipig knee cannot be fully extended. It has a maximum extension of about 30 to 40 degrees. The extensor digitorum longus, as pictured here by the asterisk, is intra-articular and originates in the proximal portion of the lateral femoral condyle. And the patellofemoral joint in the Minipig is much more elongated compared to that in the human. Pictured here is a right Minipig knee in the supine position. The anterolateral and anteromedial portals are marked. Note how they are more distal to the distal pole of the patella. We first begin by incising the skin with an 11 blade to establish the anterolateral portal. The arthroscope is then introduced into the knee and placed into the medial compartment. The anteromedial portal is established under direct visualization with a spinal needle and 11 blade. A probe is then introduced into the anteromedial portal. Noted here are two surgically created chondral defects of the medial femoral condyle. The synovium can then be probed and retracted, and the medial meniscus is visualized. Pictured here is a better bird's eye view of the medial femoral condyle being flexed and extended. Again, note the two surgically created chondral defects on the medial femoral condyle with some synovial adhesions attached to the more posterior defect. An arthroscopic shaver can be introduced to release the ligamentum mucosum and debride the fat pad to better visualize the cruciate ligaments in the intercondylar notch. The ACL with some overlying synovium is being probed here. The camera can then be turned to the lateral compartment where the lateral femoral condyle is visualized. Note that the extensor digitorum longus being probed here is intra-articular. It can obstruct visualization of the lateral femoral condyle. Finally, the camera can be turned to visualize the distal trochlea. Because the trochlea is elongated and because the Minipig knee cannot be fully extended, it can be difficult to introduce the arthroscope into the patellofemoral joint without creating a separate superior portal. Thank you very much.